Planet Vero Studios, brought to you by Evergreen Media, creating cohesive marketing campaigns. Evergreen Media in Vero Beach.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
And good afternoon. Welcome to Community Conversations. You know, I was listening to the front end. You know, we do try to stopgap a lot of different needs in our community, but we can't do it ourselves. We do primary care, which covers medical and dental, pharmaceuticals, behavioral health. But there's a lot of great collaborators in our community, one of which is the Substance Awareness Center. So today I'm very pleased to have Carrie Maynard Lester and her cohort, Molly Scanlon, who is here to talk to us about some of the supportive systems that they have in place. The Substance Awareness Center certainly has raised our awareness of substance use disorder and the fact that just like diabetes, it's not something that you do to yourself. Sometimes it just happens, right?
Correct.
Yeah. And then that leaves the family and friends in a quandary in terms of how can they best support them. So that's what we're going to talk about today. And the acronym that you guys use is CRAFT?
Correct.
So, Molly, what does that stand for? It's a quiz.
It stands for, thank you, Vicki. It stands for Community Reinforcement and Family Training. So community reinforcement is a common approach in therapy, whether it's substance abuse or something else, which is you try to encourage clients to find support for things around them, their family, their friends, right? And the family training part is the skills that I think we'll talk a little bit more about.
That's great.
Later on, yeah.
So when you talk about the community part, my mind automatically goes to our old standby of AA, Alcoholics Anonymous, and the 12-step program. And certainly a lot of folks do not feel comfortable with that type of group environment. So they might be supported by churches or other support groups or just a cluster of friends and family members. So how did you come up with this as a supportive delivery mechanism, Carrie?
Well, so in my years at the Substance Awareness Center, I've worn many hats. I am now the executive director, but there are often times I was on the receiving end of phone calls. Okay. And you would hear phone calls from family members, loved ones. I'm worried about my son, my daughter. They need to get into treatment. How can I help them? And as we peel the layers together, I started offering free family education sessions. And as I met with these families, it became very clear their loved one wasn't quite ready for treatment. And they needed a lot of help and a lot of support. And so we would make referrals to Al-Anon, which is a 12-step based support group, and family members just weren't ready to receive that message. They were feeling a sense of powerlessness and panic, like my loved one needs help now. And so I did a little bit of research and I learned about the CRAFT approach and its effectiveness with substance use disorders. And so the research shows that 7 out of 10 persons, loved ones, whose family members went through the CRAFT program, learned those skills, practiced those skills, their loved one went to treatment and stayed in treatment. And for the 30% who did not go, they reported a significant reduction, even though their loved one didn't go to treatment, in their own anxiety, their own depression. And so at the Substance Awareness Center, we're always looking for evidence-based interventions. And this was one that I felt was really important that we bring to our community, because I feel like the family is the missed, the unidentified patient. They need as much help as the person who struggles with a substance use disorder. It is
sometimes more, because we aren't quite as loopy, perhaps, as the person that's still needing treatment. Our brain's pretty functional, and that anxiety rises pretty quickly.
Yeah, you're living the loved ones are living in the reality of the destruction, and where, the person who's using substances really isn't even in their right mind most of the time. Yeah. So this was a great thing that we're able to bring to our community. And so Molly's been able to go through the training. We have a volunteer that has a loved one in her family. She's got a lot of years of Al-Anon behind her, so she co-facilitates with Molly. Yeah. And
that's so essential, because it sounds easy to set up a support group, but that requires that constant presence of a facilitator. And the reality is every facilitator has their own life as well. So they have things that they have to say, I'm sorry, I can't be present on this day or that day. So having a co-facilitator is a wonderful gift. So whoever you are, thank you on behalf of all of us. And those that perhaps would be engaged in that, I'm sure there's more opportunities for volunteers whether you call them a facilitator or a peer.
Absolutely.
You can put them through the training if they have some lived experience and want to be part of it. And so it's a great value because Molly's able to bring the clinical aspect to the group and facilitating and working with the families and the friends. And she really comes in as the role of more of a peer with her lived experience and sharing. I've lived this, and this is how it can work.
Because sometimes it's hard to verbalize, particularly in a group, what you're thinking or feeling because you don't want to look stupid, or you're already feeling stupid being in a group sometimes, it's out of our natural habitat. And so having somebody that can put those things in words for us is so helpful.
Yes,
and you'll get through it. And my family said exactly the same thing to me, or I said it to my daughter, or whatever.
Right, right.
And it's skills-based, and Molly can get into and talk about the skills that people learn, but it's also then a place to talk about what worked or didn't work, or how did I use this skill, and this is what happened. And the program, we offer it in a group setting. It can be offered individually, one-on-one through our organization. We can also connect people with online resources, virtual trainings and sessions. We just want to reduce any barrier. We want to make sure people can get access to this. Nationally, we used to say only 10% of Americans with a substance use disorder ever access the specialty treatment they need for that. And family and friends have an important role in helping people get into the treatment because they have a brain telling them, the substance users have a brain telling them, I don't have a problem. It's not that bad. I don't need help. And so when family members can learn these skills, they can help move the needle on that data point. But I will tell you, the
more recent data,
6% in 2021, 6% of Americans with substance use disorder access to the treatment that they need, only 6%. So our family members, our friends really do have the ability to influence people and help them stay in treatment. Substance users go to treatment and they stop going. And so
I'm good now.
Those craft skills help keep people engaged in the treatment and the recovery they need.
So are there, before I leave this topic and we find ourselves suddenly having to take a commercial break here, I want to finish it up. Are there any barriers to being an advocate, a facilitator, or a peer? In other words, sometimes, particularly as a peer, people will say, well, I'd love to, but I have a felony, or I'd love to, but I don't have that much time.
Sure.
What do you see as real barriers, or is it an individualized kind of thing? If you're interested, call us and we'll work through the pluses and minuses.
I would say really one thing we do at the Substance Awareness Center with our staffing needs and even our client needs is it's very individualized. And so I would say anyone who's interested in learning more how they can be a part of it or receive services, call us. We will work with you one-on-one to find out what best meets your needs. I will say a lot of work has been done in the field of substance use with background screens, with changing certifications and regulations that make it a little bit easier for people to get in the field with that lived experience. And we've walked several staff through the process of getting clearance, even though they've had felonies in their background. We've been able to work
unfortunately, we learn by doing, and sometimes that's not easy to get off your record or impossible in some cases. And yet, we've got 40, 50, 60 years in front of us, perhaps.
Sure,
and
absolutely.
And a lot to give back and offer in the field, because that lived experience, we see the value in that, and their certifications and trainings. People can get certified with lived experience as a family member. So if I have a son or a daughter or a loved one, I can use my lived experience and become certified. I can get certified based off my own lived experience for substance use. It can be off of mental health. So there's several certifications, and anyone who's interested, I take them through the Florida Certification Board and show them what opportunities are available in this field. So
instead of hanging on to a stigma of it as being a previous user, I hate that word, but that lived experience, now that stigma can turn around from someone who is dependent and needs others to being a helper themselves.
Yeah, it really transforms that liability into an asset. Yeah, absolutely.
Okay. Well, we are going to take a short break, and then we'll come back and we'll talk about the very specifics of the teaching, the criteria of craft. Thank you. We'll be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
Who's got time to clean when you need it clean? Call Germ Wizards LLC using the most up-to-date equipment. Germ Wizards pays strict attention to detail. They make dust disappear. Whether you need your office to sparkle, your home to shine, or you want to give someone a great gift, hire the Germ Wizards. It's easy to get a quote online. There's even an online portal. To discuss details directly with your cleaning professional, visit germwizardsllc.com. Make dust disappear with Germ Wizards.
Is owning a home your goal? With the rising cost of rent, you could be saving a lot of money by owning your own home. At Caliber Home Loans, we can help make home ownership a reality. Meet with us for a free consultation and get on the right path to buy the home of your dreams. For Caliber, home loans is all we do. We use local appraisers and offer a variety of loan options to fit your lifestyle and budget. Call us today, 844-GO-CALIBER, license number CHL 15622, CaliberHomeLoansTreasureCoast.com.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule, and I'm the CEO of Treasure Coast Community Health. And our job is to provide primary care visits for all kinds of different reasons, whether it's a small child that needs a pediatric visit, school physical coming up, and we do have a few more slots, so if you haven't scheduled that yet, please do. We also take care of adults all the way up through the 100s, and we also take care of behavioral health folks, substance abuse disorders, pharmaceuticals that go with all of those things, behavioral health, dentistry. How could I forget that? Such an important thing. It starts in your mouth, and it affects both going up and going down. So if you're looking for a primary care provider, don't hesitate to call us at 257-8224. Today, though, I am working with a collaborator, the Substance Awareness Center, otherwise affectionately known as SAC. And Carrie Lester is the executive director, and Molly is one of their coordinators of their day treatment program. Mm-hmm. So I know today we're talking about supporting families, but for those that don't know much about this supportive features that you give, why don't you give us kind of the ABC roster, including the fact that you do have homes where you support individuals.
So really, to meet our mission, we embrace 2 positions. Prevention works and recovery works. And so we could spend a whole show on prevention works. We know substance use disorders can be prevented. They start in adolescence and are prevented in adolescence. And so we do a lot of programming in the community with partners to help protect that vulnerable developing adolescent brain. But under recovery works, we know people can and do recover. And it's really important that we share the hope and beauty that recovery is possible. And so we do that with a highly structured day treatment program. And Molly is the counselor for that program. And we have a step-down program, outpatient treatment. That would be for people with a milder substance use disorder or stepping down from day treatment into our outpatient program. It's not as structured as day treatment, so we can be a little bit more flexible around the appointments and the services.
So people can continue working, for example.
Correct, yes. Okay. Yeah. Where day treatment is 16 hours of treatment a week, it's structured 9 to 1, Monday through Thursday. So people could work outside of those hours, but the focus is treatment there. And then we have our recovery assistance program. So with the philanthropy in this community, we've been gifted 2 homes. And so those homes right now are being run for men in early recovery. And we have peers who manage and operate those homes. And we offer all of our services regardless of ability to pay. And I mentioned
regardless of ability to pay, they are free. I got to say that again, because that's such a barrier to most people and their families concerned, because honestly, people with substance use disorder kind of run through a lot of money, theirs and then their families and their friends. And so by the time treatment comes up into the conversation again, it's like, man, you've trapped me for the last time. I cannot afford to put you in treatment. But all the services that you offer are free.
Our treatment programs, day treatment and outpatient, are based off of a wage statement from Social Security. Okay. But I would say it's a very generous wage statement or a sliding fee scale that people pay. Okay. Our recovery assistance program, once you start working, you pay a nominal fee of $50 a week in rent. The majority, we serve really the underserved in our community. The majority of the people with substance use disorders that come through our door aren't necessarily, working full-time jobs, maintaining health insurance. And so it's a gap that we fill in the community. We serve over 200 adults a year in that program. And I would say the majority are paying $3 or less for their services.
I'm going to have to get us T-shirts that says gap fillers or something.
There's lots of gaps and holes in the community.
There are, but, everybody takes a little piece and does what they can. And to that end, I know that SAC is a nonprofit, so if this strikes a chord in your heart, I'm pitching for dollars for Carrie's organization.
And we truly can't do what we do without the community's support. We do have a 5K coming up September 30th, and that is September's National Recovery Month. So we'll be wrapping up the month with a 5K. So if you can support us by being a runner or a walker or a sponsorship.
And we didn't even plan this discussion, did we? So I'm going to come back to you, Molly, though, because before the break, we were talking in general about the CRAFT program, that it is intended to follow evidence-based mechanisms that are in place in other organizations.
Correct.
That you guys have copied and maybe modified a little. I don't know. Yeah. So tell us about that, the criteria and how that works.
Yeah. So CRAFT is based on the science that we know about how people actually change their behaviors.
Okay.
So positive reinforcement is the most effective way to change behavior.
You listening, parents? It's not threatening to beat them with a spoon.
Right. That would be negative reinforcement. And with positive reinforcement, we see the behavior, we acknowledge it or tangibly reward it even. And then when the desired behavior isn't happening, you just remove the positive reinforcement. You don't apply a negative reinforcement. Okay. And so what this does is when we work in CRAFT, initially the friends and family who come in, they have a lot of knowledge through their skilled experience, like their lived experience of why their loved one uses, when their loved one uses, what are the triggers, both internal and external. An external trigger could be something like payday. Now I've got money. Not right. An internal trigger could be something like anxiety or PTSD, right? Or just emotional dysregulation, just feeling overwhelmed by pain or by stressors, So they learn to look for those things in their loved one and, create situations where maybe they can keep their loved one safe just a little bit longer. Anytime that the loved one is doing desired behaviors, which means anytime that they're not using, that is a time where we can reward the loved one with our presence, with spending time together, with support for things like transportation or groceries or things like that.
So it's not necessarily verbally acknowledging you're doing a really good job of staying on the wagon or staying clean or whatever
That's just one way of acknowledging, right? Okay. We talk a lot in CRAFT about how your presence is a gift to your loved one, right? A lot of what's lost when people are suffering with substance use disorders is relationships, because really the substance is the most important relationship, right? So a lot of our relationships go by the wayside. But with CRAFT, we kind of do it as a way of the relationship itself becomes something that is regained through non-using behavior or going to treatment or things like that. But not in a way that's held over their heads or bribed in any way. It's simply making it a little bit clearer that, when I kind of choose health and I choose accepting help, right? And I understand the disease that I have, right? Positive things come from doing things like going into treatment or accepting help from others or, doing the hard work of recovery, right? And so we want to reward people.
I bet you have a lot of Q&As going on in those conversations.
Yes, absolutely.
And I would say for anyone who's lived with or has a loved one who struggles with a substance use disorder, the natural reaction is to be negative and punitive. The behaviors can be so egregious, they can be so angering and hurtful that people naturally are going to do negative reinforcement, not positive reinforcement. And so this program really is, they need the support, they need to learn the skill and understand why it's so important to use that positive reinforcement.
And receive positive reinforcement themselves.
For doing it. Exactly.
You're absolutely right. It's not easy.
No, it's no. It does. We do not expect the families that come to us to be able to, practice this skill and have this skill overnight. That's the whole reason the program exists.
So are there things like role playing, or is it really... you talk a little bit, they ask questions. How does that work?
So we use tools from an organization called Allies in Recovery. They actually have done some amazing work about getting the craft model out there, and that's who's facilitated the training for me. Our peer, Nancy Lynch, who's amazing, and a couple other counselors at SAC. And some of it is, it's kind of like learning a skill. So learning some positive communication techniques, and then practicing that skill in the group. And then from the time that we meet on Thursdays at 5:30 until we meet again the next Thursday at 5:30, they have a chance to practice that skill. So, for example, something that we do is like intentional and positive communication. So we use the acronym PIUS, P-I-U-S. And so P for purposeful, I for I statements. So I keep the focus on myself rather than saying to my loved one, you are, right? Which immediately puts up our defense systems, right? The U for understanding. We listen to understand, not to blame, not to, right? That kind of thing.
Sounds like raising a teenager, honestly.
So, and I will say that these skills can be very helpful in many capacities. And we really encourage on the prevention side, with that indicated prevention we do, we encourage those families and those parents to get connected with this program, because those skills are going to help them navigate these teen years, especially for kids who are starting to dabble in substance use.
I'm glad you brought that up too, because I think also, we have people coming to the craft program that they've got an adult child who's 50, who's been living in recovery for a long time. We have somebody who has a 16-year-old who's just having a really hard time stopping marijuana. The potency is so high, and they just,
and that can vape it, nobody knows. Yeah.
And the parents they don't know what to do anymore, So, and I just want to emphasize too, the space of the room is really open and non-judgmental. Inevitably, these family members know what's best for their quality of life, the quality of life of their family, and what might actually reduce use or stop use entirely in their loved one. So they're given a lot of, they're the expert in their family. We're just bringing some skills that might help them navigate that.
So you said it starts Thursday at 5:30. How long does a group normally go then?
It's an hour long.
Just an hour.
Yeah.
Okay. So you're home for dinner.
You're home for dinner. Exactly.
Okay. And I presume that, again, because people have busy lives, but you're meeting them where they're at, literally, you then can drop in, miss a couple weeks, come back, whatever. Works.
The group is open.
It's an open group. Okay. Absolutely.
Okay.
You can come
no
when
reservations
you can.
needed.
No reservations needed. Yeah.
And do you meet at your building on 60th?
We do. So 1507 20th Street.
Okay.
Thank you, Carrie.
I know.
Right across from the courthouse. Yeah.
Okay.
So it's open, and
it sounds wonderful.
Yeah. Thank you.
It reminds me a little bit of Al-Anon, but it sounds like it's got more transferable skills, as you said, to parents, regardless of how old their children are or where they themselves might have been in the past.
Right.
And it aligns very well with Al-Anon. So family members who do use Al-Anon or will, after going to craft, may start to branch into Al-Anon. There's differences, but they also align in certain areas.
Is there an active Al-Anon group in Indian River County anymore?
Oh, yes. There's several meetings that are ongoing. Yep.
Okay.
And it's a wonderful resource.
Okay.
Yeah.
That's great to know. I really appreciate you guys being here and sharing this information. And I encourage any of you, none of us is perfect, and we all have some history, but together we can do outrageously wonderful things. So thanks for being with us, and we'll stay tuned next week. And we'll have you guys back again in a couple of months so you can give us some updates on other things that you're doing.
Sounds great.
Okay?
Thank you,
Thank
Vicki.
you so much, Vicki.
Thank you. And have a great evening, all.